Hello, and welcome to the Knee Diaries. My name is Kimberly Jones, and this is my co-host, Andy Guzzi.
Hello, Kim. The Knee Diaries is a global information source dedicated to people suffering from arthritis and sports injuries.
Today's topic is ligament injuries and the prevalence and osteoarthritis of the knee. Let's start by discussing the case of a 45-year-old male.
He states about 5 years ago while skiing, he suffered from a fall. It was very painful, and it was necessary for emergency personnel to bring him down the slopes using a stretcher.
He had an MRI done immediately following the injury that showed a complete tear of the anterior cruciate ligament, or ACL. That was then followed by an ACL reconstruction.
The patient required about 6 months of physical therapy and rehab following the surgery. He did well and was able to ski again for several years until his pain and swelling started up again.
He went back to a surgeon who diagnosed him with severe arthritis of the knee and recommended that a total knee replacement be done.
But the patient felt he was just too young to have a total knee replacement and began looking into orthopedic regenerative medicine as an alternative.
He is otherwise a healthy male. He does not have any other medical conditions and does not take any medications.
There are 4 ligaments holding the knee in place, one at each side of the knee known as collateral ligaments, which keep the bones from moving from side to side.
And 2 crossing over the middle of the knee, known as the cruciate ligaments, which stop the bones from moving forwards and backwards.
The anterior cruciate ligament, or ACL, can be injured by severe trauma or through twisting of the knee by a forceful motion.
The cardinal manifestations of an ACL tear are typically pain and swelling. The best way to diagnose an ACL tear is by doing an MRI. However, the Lockman test can also be used.
In the Lockman test, the examiner bends the knee about 30 degrees. Then the femur is stabilizing using one hand while the other hand is placed behind the proximal tibia at the level of the joint line. Then the examiner pulls the tibia forward, noting the degree of anterior tibial displacement and looking for instability.
The ACL reconstruction may help initially, but eventually the knee will develop severe arthritis. This is mostly due to the surgery, which causes tremendous amounts of trauma to the joint.
Another ligament that is commonly injured is the lateral collateral ligament, or LCL.
The LCL is located on the outside of the knee. Typically, these injuries occur when the knee is forced to bend inward.
In other words, this ligament is mostly injured by excessive pressure placed on the knee joint from the inside, resulting in a large amount of stress on the outside of the joint. This process is also known as varus stress.
Parallel to the LCL is the medial collateral ligament, or MCL. The mechanism of damage is exactly the opposite of the LCL.
The MCL is located on the medial side of the knee. Typically, the injury occurs when the knee is forced to bow out.
Meaning this ligament is mostly injured by excessive pressure placed on the knee joint from the outside. This results in a large amount of stress on the inside of the joint. This process is also known as valgus stress.
The posterior cruciate ligament, or PCL, is located near the back of the knee. The PCL is not commonly injured ligament.
An injury can occur from a simple stretch or trauma to the knee. Depending on the severity of the ligament's damage, the result may be instability. This instability could produce arthritis and a future need for surgical correction, which may lead to a total knee replacement.
My name is Andy Guzzi. This is Kimberly Jones. Thank you so much for joining us and have a great day.